Goree, and today I'm going to take a few moments to explain to you about medication errors, which is taught in the Nursing 330 course titled Law and Ethics for the Healthcare Professional of the University of Mount Olive RN to BSN program. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive, and this short 5-minute lecture will be using the principles of adult learning theorist Malcolm Knowles, which is covered in the text Nurse as Educator, Principles of Teaching and Learning for Nursing Practice. I have 3 goals and objectives for this brief lecture, and they are: 1. Define what a medication error is; 2. Name steps to take when a medication error has occurred; and 3. Give examples of how to prevent medication errors. Let me give you a brief overview of medication errors. Medication errors can happen in the healthcare setting and in the community as well. They can be committed by healthcare professionals as well as patients and consumers. Some medication errors can cause no harm, some harm, or unfortunately death. Healthcare professionals desire that no medication errors occur, but that is not humanly possible. A great example of this would be if a nurse had a patient assignment with 2 patients with the same name, Joseph Smith. Both patients were prescribed the same antibiotic with the same dosage, but different frequencies. When the nurse went to give the first Mr. Smith his antibiotic, she began with confirming his name, date of birth, drug dosage, and scanned the barcodes on the ID band, such as this, and on the medication bag. Then she was uninterrupted for a phone call at the nurse's station. She hung and started the medication without completely finishing the computer documentation before going to answer the call. When she returned, the medication was halfway done, and when she went to close out the transaction on the computer, a prompt came up telling her that it was 2 hours too early for the medication. The second Mr. Smith was actually due his medication at this time, not the first Mr. Smith. She quickly stopped the medication, informed Mr. Smith that she had to check with the doctor about the time of the medication, and went and called the doctor about the error. Gratefully, the early administration posed no threat, and subsequent administration times were adjusted, and she restarted the already hanging dose. The medication error here was that the antibiotic was given too early, the wrong time. The nurse stopped the medication and informed the patient and the doctor of what occurred, her actions taken. The nurse recognized the need for uninterrupted medication administration so that she would have seen the time prompt before she started the antibiotic and completing an intervention before starting another. Ways of prevention. Nurses must always remember to do the 6 rights of medication administration: right patient, right dose, right drug, right route, right time, and right documentation. And also do a triple check of medications, which is check the medication against the doctor's order when the medication is received from the pharmacy, right before you prepare the medication to give, and right before you actually give the medication to the patient. This brief lecture on defining what a medication error is, naming the steps to take when a medication error has occurred, and giving examples of how to prevent medication errors, and it was supported by current evidence found on the websites of the FDA, or the Federal Drug Administration, and also DHHS, or the Department of Health and Human Services. Thank you for your time and attention today. Please complete the short survey provided through the Nursing Student Center and email it to my professor, Dr. Joy Kiefer, at kkeefer@umo.edu within the next 3 days.